Alright, so I will be testing range of motion at the hip for hip flexion. So we're going to have Stanford Live supine on the table, and we're going to place our axis of rotation at the greater trochanter. So we want to palpate to locate that area which is near the joint of the hip, or at the joint of the hip. And our stationary arm will be along the trunk, or the midline of the trunk or the pelvis, and then our mobile arm would be at the lateral epicondyle of the femur. So, Sen, if you can please bend your knee and flex your leg towards your chest, or bring your knee towards your chest. Yes. Okay. So he is at 125 degrees of flexion on the left side. Alright, you can go back down. We're going to palpate again for the trochanter, greater trochanter. We're going to put our axis of rotation there, and our stationary arm alongside the hip. And our mobile arm will be on the opposite side of the femur. And can you please go ahead and move up? Yeah. And this one is at, oh, let's do this again. So again, I'm palpating, we're going to do this again. Alright, go ahead. This side is 110 degrees. So, shows here that range of motion on the right side is less than the range of motion on the left side. Alright, so we're going to be testing the iliopsoas manual muscle test. So first, we're going to have Stanford to flex his knee or his hip by bringing it up off the table. To see if he can do this against gravity without resistance first, and then we're going to apply resistance and grade him based on his results. So first, can you please pull your leg up just like this off the table, over there. Okay, and try the other. Alright, so since he's able to do that, we're going to test or apply resistance against gravity. So go ahead and bring your leg up. We're going to place this hand that we're using to apply resistance proximal to the knee joint, and I'm going to push down and have him to hold his leg in this position. Ready? Alright, and the next one, up. Same thing, proximal to the knee, and going down. Alright, so I will test his right side out of 5, since he was pretty stable, and his left side out of 4, since there was a little bit of give here and there. And that was your manual muscle test for the iliopsoas muscle.